Hello everyone, I am Dr. Bonnet and today we will be discussing acid and basis imbalances. Alright, so the first thing you need to know before we even get started is your normal ranges. So your normal pH is going to be 7.35 to 7.45. Your PCO2 level is going to be 35 to 45 and your bicarbonate level is going to be 22 to 26. So it is so important that you memorize these numbers. All right, so how do you analyze ABGs? So number one, you want to check the pH. So the normal pH is going to be 7.35 to 7.45. So if it is on the lower side, so if it is less than 7.35, that is going to be acidosis. If it is higher than 7.45, it's going to be alkalosis. So then you want to check the PaCO2. So this is your respiratory, right? This is our carbon dioxide. So normal levels is going to be 35 to 45. If it is high, the patient will be experiencing respiratory acidosis. If it is low, the patient will be experiencing respiratory alkalosis. So then you want to check the bicarbonate level, and this is your metabolic. So with your bicarb, normal levels is going to be 22 to 26. If it is low, then it will be metabolic acidosis. If it is high, then it will be metabolic alkalosis. So the next thing that you want to look at is the assess for compensation. So what do you mean when something compensates? So sometimes your body can starts to see that it's going down the wrong path, and then your lungs could say, which is the respiratory, can say, hey, I can turn this around for the good. Or your kidneys can say, wait, let me try to turn this around. So if you have one abnormal level, that's going to be uncompensated. But if you have two abnormal levels, that's going to be partial or full compensation. So how do you know the difference between partial compensation and full compensation? If something is fully compensated, the pH will be normal. The pH will be normal, and we will work through some problems together, okay, to give you a better understanding. But just please make sure that you know all your levels, your normal levels, because it's hard to do ABGs if you don't know the normal levels.
All right, so I do my ABG calculations by doing the tic-tac-toe method. So you can easily draw out this little chart on your paper, and what you want to do is once you figure out what the pH is, you then will put it in the correct spot. And then if you have two in a row, that's what it is. So let's go over it because this may seem confusing. All right, so the question says that the pH is 7.31, the PaCO2 is 30, and the bicarb is 18. So I also put a little cheat sheet on the side of the screen for you, but make sure that you remember this because this will not be on your exam. So you're going to have to commit this to memory. Also, the pH down there, one thing I want to mention about the pH. So you can have a normal pH, but some questions require you to know if the pH is on the normal acidosis side, meaning if the pH is less than 7.40, it's going to be normal, but it is going to be on the acidosis side. So let's say if the pH was 7.35, that is considered normal, right? But it's on the normal acidosis side. All right, let's talk about if your pH was greater than 7.40. This is going to be on the alkalosis side. So let's say it was 7.43. Even though it's normal, it's on the normal alkalosis side. So I definitely wanted to point out these things before we go into working our problems because it'll make sense. So remember that you need to remember all of this because you won't have this on your exam. So remember your normal ranges. So normal ranges is 35 to 45 for your CO2. So the chart even says on here, if it is less than 35, is alkalosis. If it's greater than 45, acidosis. With your bicarb, normal ranges is 22 to 26. If it's less than 22, acidosis. If it's greater than 26, alkalosis. All right, so let's jump into our first problem. So our pH is 7.31. So let's start with there. All right, so our normal range for pH is 7.35 to 7.45. So this pH is below 7.35. So this pH is considered to be acidosis. So we're going to write pH under the acid area, okay? All right, so then our PCO2 is 30. So normal PCO2 is 35 to 45. So the PCO2 is low. So that's going to be considered alkalosis. So we're going to come over here and write CO2. All right, so the bicarb is 18. Normal bicarb is 22 to 26. So that bicarb is low. So that's going to go under acidosis. So we're going to write bicarb on here. All right, now we want to see, do we have two under the same column? And yes, we do. So we know that it's acidosis because we're under the acidosis column. And which is under the what is under the acidosis column? It is your bicarb. So bicarb is your metabolic. So we know that this patient is experiencing metabolic acidosis. Now we see that our respiratory, which is our CO2, is also out of whack. So we would have to say that the patient is experiencing metabolic acidosis and they are partially compensating. So what does that mean? That means that the body is now trying to compensate through the respiratory in order to bring this patient into a equal balance. All right, so the pH is 7.35. So normal levels is 7.35 to 7.45. So that is normal. So we're going to write it under the normal side. All right, and then the PCO2 is 48. So normal ranges is 35 to 45. So we're going to write that under the acidosis because it's 48, so it's a little elevated. So we're going to write the CO2 over here. All right, and then our bicarb is 29. So normal ranges is 22 to 26, so it's 29, so it's elevated. So it's going to go under the alkalosis side. All right, so we now want to look and see, do we have any under this? Do we have two under the same column? And we don't. So what we have to do is go back to the pH and figure out, is the pH on the acidosis side even though it's normal, or is it on the alkalosis side even though it's normal? So the pH is 7.35. So our little chart on the side said that if the pH is less than 7.40, it will be considered acidosis. So even though it's normal, it's on the acidosis side of being normal. So the pH would then go over here. It would then go on the acidosis side. Now we want to look and see, do we have two in the same column now? And the answer is yes. We have the CO2 and we have the pH. So this patient is experiencing respiratory acidosis. Now, is there compensation going on? Yes. Why is there compensation going on? Because the bicarb is also out of whack. But what type of compensation do we have going on? We have fully compensation going on. And how do we know that? Because the pH is normal. If the pH is normal, there is full compensation going on. So the answer is respiratory acidosis with full compensation. All right, so the pH is 7.35, which is normal. Our CO2 is 49, which is elevated, so that is acidosis. Our bicarb is 30, which is elevated, which is alkalosis. So we're going to look at our chart to see, do we have two under the same column? And we don't. So we need to assess and see what's going on. So we're going to have to look at our pH. So is our pH on the acidosis side of normal or the alkalosis side of normal? So your little cheat sheet says that if the pH is less than 7.40, then it's going to be on the acidosis side. So we're going to move our pH to the acidosis side. All right, so now we have our pH and our CO2 under the acidosis. So our patient is experiencing respiratory acidosis, but there is some type of compensation going on because our bicarb is not normal. So how do we find out what type of compensation is going on? In this problem, we're going to look at the pH. Being that the pH is normal, this patient is experiencing full compensation. So the answer is respiratory acidosis with full compensation. So we know anytime that the pH is normal, there is going to be full compensation.